Duke University's Big Ideas Lab just announced a new partnership with the company Evidation. The goal is to create more diversity in digital health studies. Joining us tonight to tell us more about this is Duke University Assistant Professor Jessilyn Dunn. Welcome to the show. Thanks for being with us tonight.
Thank you so much for having me.
Let's start with the basics. Some people may not know exactly what Duke's Big Ideas Lab does, so give us kind of the baseline of the work that you do there.
Absolutely. So our goal is to develop new technologies in digital health. One of the major aspects of that is bringing healthcare outside of the clinic. So using things like smartwatches and smartphones to improve how we can monitor and bring healthcare to people. And so as a part of that, what we do is we develop something called digital biomarkers. And that means we take continuous measurements of heart rate, movement, sleep from these devices, and we use them to predict things about people's health. Most recently, one of the studies that we've been running is COVID-Identify, where we are developing early markers of COVID-19 infection from smartwatch data. And our goal is to be able to bring healthcare to the masses who may not otherwise have access.
Tell us how you do that. How did you identify diversity as a pitfall here, a shortcoming in some of the data that you were receiving, and what is going to be done to close that gap?
Yeah, absolutely. So that COVID-Identify study that I mentioned was part of how we identified this overarching problem in digital health studies, which is that we run these large studies that are, for the most part, bring your own device based. Mm-hmm. And we talked with our colleagues and collaborators across various different institutions, including Evidation Health, and found that on race, gender, ethnicity, and on age, our diversity is quite low. And so what we're trying to do is identify factors that include device ownership, that include the way these studies are designed, that can help to include everybody. Because when we use the data from these studies, we develop new technologies. And if we don't have data from everybody, then the technologies don't represent everybody. So it's incredibly important that we can gather representative data by making sure that everybody is included in these studies.
Tell me about the partnership with Evidation and what you hope to accomplish moving forward.
Absolutely. So right now, one of the major research projects that we're working on is retrospectively analyzing data from our COVID-19 studies. So our studies were on the order of tens to nearly 100,000 people. So very large studies. And what we learned over the course of these studies was that there are different patterns of adherence and retention in these studies based on demographics factors like race, gender, ethnicity, age, and so on. And what we're trying to do is identify factors that can help to retain people in studies and help to increase their adherence to the studies so that the data that we get works well for everyone. And so right now, what we're really doing is more of a deep dive into the data to understand how our past studies have gone and design future studies that can include more representation.
Great. Thank you so much. I appreciate your time tonight. Duke University Assistant Professor Jessilyn Dunn, thanks so much for joining us and giving us some insight.
Thanks for having me.